You know how they say, you don't get an award for birthing naturally? No, I do. I don't have to go through questioning myself for the next several years, asking if my body can actually do it, because I know my body can now birth a baby, and I'm so confident in that. It's just the question of, can I get rid of the placenta? Welcome, part 2. This is the part 2 to my very hectic birth story, and if I look a little distracted, it's because my son is just playing right in my eye line, but he keeps falling off the seat that he's sitting on, so we might have a fall counter for this video. We will see. He's fine every time, don't worry. Welcome back to my free birth to hospital transfer with a bit of preeclampsia and a little bit more hecticness. If you'd like the full rundown on the before to hospital transfer, you can check that out in that video there. This is kind of after Bub was born. He was born at 9:48, and I was fighting off hands, trying to get to him. There was so many people in the room, all just trying to do things, and it's just like, let me just be. It was so disturbing. So I was taken over to the bed. We popped down on the bed, which I shouldn't have done. It was under just such serious bright lights. And also, I would like you to know that I got my L&D notes and I was going through them, and so I have timestamps this time. So his birth weight was 3.91 kilos, which is good size, but he just had a really big head, comparatively. I think it was, did I write it down? No, I didn't. It was a big head. His APGAR scores at 1 minute. First of all, APGAR scores, if you've had a natural birth, you haven't had any anesthetic, and your cord hasn't been cut at 1 minute, APGAR scores are like not reliable because they're designed for a very specific situation. But his APGAR scores at both 1 minute and 5 minutes were a score of 8. So we got skin to skin. I'm lying down on the bed, him on top of me. They're scrubbing the vernix off of him. And I'm like, stop, like, leave the vernix. But they just kept going. They're like, oh, we got to stimulate him. I'm like, no, he just needs a moment. Like, he's had a very hectic birth. Like, just give him, like, space. And I get it from a medical point of view, but, like, from a physiological point of view, just let the child be. And so we're just there, like, just trying to take in the fact of what all just happened over the last 2-3 days. And about 10 minutes, they noticed that he started to make little grunting noises, kind of just breathing very fast. And so they tried to call in the pediatrician. Unbeknownst to me, he was like to them, well, if she hasn't cut the cord, there's no point in me coming over to assess. And so they start pushing for a cutting of the cord. They give us like an extra 10 minutes. The cord is somewhat white by then. So I was okay with it. But I shouldn't have done it. Just purely from the point of view that it just separated the two of us. And then separated us into two different, in a sense, patients. Two different areas. And yeah, it kind of severed that authority that I had over him. That's my biggest regret, kind of letting them cut the cord and letting them take him away from me. So my husband cut the cord at about 10 p.m. The pediatrician arrived 4 minutes later, and they immediately started CPAP and suctioning. And if I had known that a CPAP means an automatic visit to the special care nursery, I would have turned it down. He was just breathing a little bit fast. Now looking back at it, it was a very quick push. He all came out in one go. After being sucked back in the push before he came out as well. And on top of that, his dad is a brass, and woodwinds player. There's probably going to be some extra lungs on this kid, some extra breathing going through this kid. And so I shouldn't have been fine with them taking him away. Suctioning was quite violent. and I think unnecessary. But that's up for debate. Of course, I wasn't the doctor that had to do it. 11 minutes later, he was transferred to special care and taken away from me. And so we had 37 minutes together from birth to transfer away. Well, not even that, because he was taken off of me 22 minutes after he was born. So we had, almost 40 minutes together in the same room before he was taken away. And the stress of that starts to settle in. The room got very quiet after he left. My husband, of course, went with him, and unbeknownst to me, they gave him like a glucose. They fed him some glucose. I don't know why. My boob was right there. And that would have actually helped me, in fact. Because then the next part of this... alright. Here, I'll try and go with the facts. So what was the blame? Transient tachypnea. I don't even know how to say that. Of the newborn. They took my blood pressure. I was sitting around 160/82. Imagine my shock. And then it became all about getting the placenta out, which of course I understand. Hospitals have policies of how long they're allowed to let things sit. But it wasn't coming. And what a surprise when you've put a mother in a very stressful situation like that, when you've taken away her kid, when she's already in a place that's unfamiliar and has already kind of received scorn. Like in my notes, written several times, patient is being difficult. I was refusing unnecessary intervention. Like syntocin would not have helped my situation. But it's just the go-to use of medical professionals every time for a birth that isn't progressing as fast as they would like. So it became all about getting the placenta out. I don't think we did a fundal massage, but surely we would have. They were trying to tug on the placenta, tried squatting over the loo. I kept getting pressured to take a shot of syntocin on them, which about 2 hours and 15 minutes later, it was eventually given, because they kept threatening, if you don't take the syntocin on, you've got to go to surgery. And part of me was like, don't stress me out. Don't add to it even more. And I've got my assigned OB. Bless her cotton socks, but oh my goodness, she was just glaring at me in the corner because I kept refusing the interventions that they were requesting. And so about 2 hours, 15 minutes later, finally get the shot in the leg. And that doesn't help at all. And it's like, okay, I think we finally need to go to surgery. And this was all very quick as well. Found out later that in an ideal home birth, you can wait up to 6 hours at least with a registered midwife for the placenta to pass. Could never do that in a hospital. But alas. So then, yes, I consent to surgery. What was interesting though, what was going on in the background is that my mum, bless her cotton socks, who had turned up last minute in the labour, uninvited but dearly appreciated and very welcome, was advocating for me to be able to see my son again, because maybe that would have helped things progress. And so what they kept telling her though was, oh no, she's not allowed to see the baby until the placenta passes. And that meant kind of whatever mode. And so it kind of sits within me the knowledge that my kid was kind of being held hostage until I consented to a surgery that I didn't really want. But right after I consent to the surgery, everything's all good again. What was happening down in special care was my kid was totally fine. He gets there, and the first opinion of the nurses there is like, what is he doing here? He's fine. But, of course, you've got to keep him for a certain amount of time. So I think he was there for at least 2, maybe 3 hours before they finally brought him back. My husband, God bless his soul, was advocating so hard. He was like, please, can she just feed him before she goes into the surgery? Good man. One of the best decisions he made. I was kind of a little bit tapped out. I was like, I don't want to breastfeed right now. Like, we're dealing with this. But we were able to feed before we went into surgery, which was so good, because if we hadn't done that, they probably would have fed him formula, and that would have caused a whole more host of issues. I firmly believe that. Okay, you're going into surgery. All right, how long is it going to be? Maybe half an hour. Cool, like it's just a placenta removal and then just checking like how bad the tear was. All right, give me a second. I've just got to save my son. I'm racing my son. So yeah, I get about 20 minutes with my son after 3 hours of being separated from him. We latch, praise God, by some kind of miracle. We get a tiny feed in, and then we're whisked away. And up until this point in my entire life, I've never actually been to the hospital for anything serious. I've had friends who have needed surgeries. I've had friends who are like lifelong patients in and out of the hospital. But praise God, that's never been me. And here I am, being rolled into my first surgery of my entire life. There's like 12 people in the room. I get a spinal tap, and they're doing all the good things, and I just pass out on the table because I'm that exhausted. Don't mind the mop. It's my son's favorite toy right now. So do the manual removal of the placenta at some point, and this image just sticks in my mind. So vulnerable. At some point, I remember waking up and my feet are like next to my ears. I'm like, what the heck? I didn't even feel that. Another point, I think they wake me up again because they believe that for the stitching, they have to put me under general anesthesia, well, like to assess properly the tear. So then that happens. Turns out they were really struggling to stabilize me in theatre. Really struggling to stabilize my blood pressure. You're okay. You're all right. No, you can't eat my thumb. So the thing that had kind of changed my mind is, as I was coming back from the toilet, a large blood clot passed, and it was about 300 mils, and it just splatters everywhere, like all over the side of the bed, onto the floor. It was really dramatic, but it wasn't actually substantial. And that's kind of like, I was like, maybe I should get the syntocin. So that's context for earlier. Apparently, I started hemorrhaging while in theatre. Apparently, I lost 500 mils, which now I guess puts me in the category of a postpartum hemorrhage. My BP was like 150/95. I was just kind of passed out. And my husband was all by himself freaking out, wondering, this was supposed to be a half an hour surgery. Where's my wife? Oh, it's all right. It's okay. We're just trying to get her stabilized. She'll be out in like no time. So my mum went home, our birth photographer and birthkeeper went home, and my husband's just all by himself. Just with like this newborn baby. Like, what do I do? So something like 4.5 hours later. Yeah, we finally see each other about 4.5 hours later. I'm woken up. I go to, I think it's observation, like post-theatre observation for an hour, and I am shaking like a crack addict. I'm like shivering like nothing else. I'm all by myself. I'm like, hello. I'm like alone except for the doctor that was there chatting with, I think another doctor or a nurse, just about random things. Do you want to go for a walk? Yeah? What do you want? You want to go for a walk, buddy? Yeah. I was recommended to try and sleep, but couldn't. Imagine that. Just wanted to be back with my husband. Just wanted my phone to text someone. Oh, it was a lot. It was a lot. You can tell I'm a phone addict because, yeah, I really struggled that hour just being by myself. Eventually I was released. I got wheeled out to see my husband and my baby, which was nice. That was a lot. We finally got to the maternity unit. I don't know, what would you call it? Maternity ward? Yeah, probably that, hey. We're just getting set up, and it's like the early hours of the morning. It must be like 5-6 a.m. And of course they're taking my temp and blood pressure can't remember if it was every 15 minutes, half an hour, or something like that. And for one of the readings, my temperature spikes. And people freak out. They're like, oh my goodness, she has an infection from the surgery and it's going to pass to the baby because she's insistent on breastfeeding. And like all these things are going to happen. And so we're already on the train of, okay, here's all your options. All right, we're going to have to do 2 rounds of antibiotics. We're going to take bloods. We've got to send baby down to special care again to get like more bloods. Oh my goodness, there's a caterpillar on me. Hello, friend. These are the itchy ones, so you're not exactly my friend. Sorry, buddy. There you go. Yeah, so we're going to do all these bloods. And both mum and baby have to be on like antibiotics so an infection doesn't spread. And yes, I get these things are important, but it's like, could you have just taken my temperature for 1 more minute? Because by the time, so the pediatrician came in, rushed in, explained all like the pros and cons for it, and by the time we had said yes to it, we do the next reading, my temperature's back to normal. But now we're on 2 rounds of antibiotics, which means we are stuck here for the next 2 days at least until we get these bloods back. And that sucked. That was a really tough time being inside the hospital when all I just wanted to do was go home and rest. And my husband was like on the uncomfortable couch. Bless him, he was able to stay overnight each night. And it just sucked. Man, it was tough. And I was going crazy because I couldn't walk really very far at all. Like it was a struggle just to walk to the bathroom, which was literally in front of me, a few meters in front of me. There was no Wi-Fi either, which made life hard. And yeah, I was just stuck there. Praise God, had lots of friends and family come over. It was great because that was a fantastic distraction. Like I'm kind of like, I think the question of should people like visit you while you're at the hospital is a complex one. If you've had a relatively straightforward birth and everything is all good, then I think no, you should bond with your baby, go home, rest, stuff like that. But if you've had a really hectic, traumatic birth, I think it's great having lots of people around you. It's also dependent on your personality, but I think it's great having people around you because it's such a good distraction. And so I was very thankful for all the people that visited me in hospital. Yeah, I must have had like 8, 9, maybe 10 visits over like 3 days, which was really good and very helpful in distracting me from me going utterly crazy. About 2 days later, I finally brushed my hair for the first time, which was amazing. I don't think I've ever gone like so long without ever brushing my hair. That was like the best self-care thing I could have done in my entire life. Sorry, a seed pod just dropped from the tree and it like hit the ground with a force of killing a person. I still have blood under my nails because I couldn't find a nail scrub. So what they don't add to the packing list, make sure you add a nail scrub for a nail brush or something like that. It was supposed to be released Friday night, Saturday morning. We were waiting on the blood cultures. They were late, I think. Really trying to pressure me into a blood transfusion because my hemoglobin, something like that, whatever you call it, was really low. Like I think the normal range is like 115 to 160 and I was 77. And yeah, I was just going stir crazy. Like I was just like, I need to get out of here. So I was conflicted because I used to donate blood and like I was like, I don't really need a blood transfusion. Like, it's not essential to saving my life. And then I don't know, the conflicting feelings of all the different reasons for and against why you get blood transfusion. Like, it was a tough decision, but eventually I got it because I was like, I'm going to be alone for long stints of time by myself caring for the baby while my husband's at work. So we may as well get it done because I need that extra energy. So I got it done. They were like, oh, are you... It took so much longer than I expected. It was like an hour or so. They were like, oh, are you having any dizziness, blurred vision, anything like that? And I was just like, we need to get out of here right now. Like, I'm just... and I was having all of that. And as a Christian, do you lie to your doctor? No, you shouldn't. But I was like, I'm so done. Like, we had already packed all of our stuff. Like, that's how much I was like, we are out of here. And I was like, internally, yes, I'm having all of those symptoms, but I need to go home right now. And I was like, nope, all good. And that sticks in my mind. It really does. Because it was good that we went home. But yeah, it was just a lot. Yeah, I really should have asked for a wheelchair as we were like leaving. Like, I for the past few days, the furthest I walked was 4 meters to and from the bathroom, and I was like getting faint. I was a little bit losing it as we're trying to walk out, but I was like, man, if I don't go, if I ask for a wheelchair, they're gonna drag me back in there. I pushed through it. I was like, let's get out of here. And it was a rainy day, I remember, and we stopped by Chemist Warehouse to pick up a few things. And then finally we got home, and my like mum and sister were there kind of greeting us home with like a little video while they were like recording us as we got home with a newborn baby. And yeah, and we kind of just settled into life back home in the cabin after everything that had happened. Yeah, that was a lot. Motherhood was tough. I really struggled kind of connecting with my baby. For the first few days, I was just like checked out. Like, I've heard this can be such an incredible spiritual time of like women almost high on DMT, just with all the birth hormones that's happening. And I was just checked out. Was it the syntocin that they had used? There's evidence for that. Was it the fact that I'd been put on a spinal tap and undergone general anesthesia in one of the most critical hormone building times of my life? Probably that factored in as well. And it wasn't for like 4 days, maybe even a week, until I actually connected to my baby. Like, you see a baby, you're like, oh, it's so cute. Oh, you're my child. But then I didn't feel something towards my child for a little while. And it finally hit one moment, and I was looking down at my kid, and I was like, wow, you are my only son, and I wouldn't give you up for the world. And then I thought of the gospel, and I'm like, oh my goodness, how great of a love for God to give up his only son for me, because I wouldn't have been able to do that by any stretch of the imagination. And that was the moment where I think we finally first connected. And it was so beautiful because it just brought such a vivid beauty to the gospel. And I think parenthood is amazing because it just really adds another layer to the gospel. There's no hidden knowledge in parenting. There's nothing that you need to actually know extra to be saved, but there's just such a deeper glory. Like, it's like watching in 720p and then suddenly the screen, like your internet catches up and now you're watching in 4K. Like, there's just such a vividness added to it and to your experience of the gospel when you connect well to your kid. And that didn't make postpartum any easier though, but it was like a beautiful moment that I sometimes cling to. Because less than a month later, I think I turned to my husband and I was like, I think I am depressed. And he was like, I think so too. And this was the day before my 24th birthday. And so I'm just going around my 24th birthday in a daze, just trying to put on a smile. I'm very grateful for my parents who facilitated like a little get together. And so that got picked up by the child health nurse, and I was placed on self-deletion watch for the next little while. I wasn't supposed to be left home alone, because there were temptations and thoughts that would just sit throughout my mind, like plans to make good use of the main road that we lived on. And that just speaks to the importance of the birth experience. That it's a good one, because the fragility of the human mind through such a tense event can really rewire your existence for the rest of your life. So that was a lot to navigate. I think on the Edinburgh scale, I got a score of 20. Anything over 13 is like immediate intervention. I think the highest you can get is 30. So they were deeply concerned for me. Shout out to the fantastic organisation When, because they organised for a mental healthcare plan through my GP, and for EMDR therapy, which I'm still figuring out theologically as a Christian. Maybe I'll do a video on that one day. But didn't solve what I was going through, but dealt with 75% of the pain of it. Like, I wasn't breaking down sobbing every day because of my birth, every time I thought about my birth and would have been taken from me. Around this time as well, I was having serious anxiety about our finances. In Australia, we have a program called paid parental leave, which is great, but you can only verify it once the baby's here, and it takes forever to kick in. Like, it's like, it's a fantastic program, but when you're waiting 3 months, like, how helpful is it actually? And because my job offers no paid maternity leave, we were just in the lurch, and my husband was working graveyards and night shifts, which was great because we had that little bit there, but it just meant that he was away from us even more so, and often I was doing a night shift by myself with a newborn. So I was really thankful for my family, who often stepped in those moments to help out, which was a massive help. But it was just scary being alone as a new parent. Like, it's just scary sometimes. You're all by yourself and this kid just won't stop crying, and you can't go on a walk to settle them because you can barely walk to the front door. Your options are super limited. So the EMDR therapy helped. Finally got on to the paid parental leave and got it processed especially fast, which was great because then that was really helpful and just eased that part of the anxiety. We moved out of the cabin back into the house because we're like, we need a space change, and it's getting a little bit constricting. Moved back into the house, and those I think were the major mental help factors. Also started trying to walk daily. I'm super thankful for my mum because she works for the NDIS and she's a carer for people, and so she was great at identifying some of the things that I needed in that time without me having to communicate them. And that's just such a testament to family. A good family and support network will be worth more than thousands of dollars on doctors and experts. She just saw me day to day and just assisted where I needed, and it was fantastic. The world kept turning because of her and my other family. To be honest, my baby was actually pretty easy. He would wake up maybe 3 to 4 times throughout the night, and with the feed go down. We did bassinet sleep for a lot of the earlier part of it. Normally for his final sleep stretch, he was in the bed with us. I do remember one time I woke up and the blanket was over his face, which was really scary to me. This was like on the second night of us being home, really scary to me. So from then I was like really intentional about the bassinet. But when he got too big for the bassinet, I was like, oh, we need to upgrade to a cot, but we don't have any money. And it was just difficult at that time for me to get out of the house and get a cot. So he just kept sleeping in the bed with us, and we didn't buy a cot for like months. So from like 4 months onward, 4 months really until now, he's just co-slept with us, which has been a massive help, to be honest, and has been, I think, the biggest thing in ensuring that we have the option to get 8 hours sleep. And I say option because do I take that 8 hours of sleep? No. I put down the baby, I go, oh my goodness, we're done for the day. Yes. And then my husband and I get distracted, watching TV or just being like, we're alive. We made it through another day. And so you relish too much in that. And then before you know it, it's 12 o'clock and you're like, far out, my kid's going to wake up in 5 hours. So my lack of sleep, yes, he would wake up throughout the night. And I think the longest time it took me to put him down, praise God, was like 40 minutes. Yeah, like in those first few months, the longest time it took me to put him down was about 40 minutes. And that was a tough 40 minutes because you're strung out. You're like, but yeah, I'm so thankful to God that after a hectic birth, I had a pretty easy baby. I had some trouble with latching. I was in extreme pain breastfeeding for a little while. But it turned out it was just a position issue. And once that was adjusted, I was like, oh, I finally get it why women love doing this. I finally get it why there's so much like support groups and like such a veneration of this, because I was like, oh my goodness, I feel so much better now. And it wasn't even like a tongue tie or a lip tie or anything like that. It was literally just position holding, which was amazing. I'm so thankful to God that was adjusted. Later in the year, so I'm slowly trying to work through everything. Like, the amount of mental energy that I have spent processing my birth, and I probably will keep thinking about it for decades into the future. But just undoing every decision, every thought, gaining more information, like re-going back through details, listening to other people in my life retell my story from their perspectives or their perspective of the event itself, slowly helping me corroborate the whole event, which was really helpful. But later in the year, I finally got to request my L&D notes, and I hired a private midwife to kind of go through it. That took hours. That took so many hours, and kind of the conclusion was like, you honestly did really well considering all the circumstances. Like, the only critique she really offered was maybe get an IV because you were dehydrated and that would have heightened your blood pressure. But then the IV would have come with the offset of limited movement, which I really needed in that moment, because baby was in a improper positioning. So yeah, that was a part tough of it as well. I learned how intentional it was, them keeping me away from my own kid in special care, even though he didn't really need to be, and how beneficial it would have been for us to actually breastfeed, because that would have helped the placenta pass. And so I don't want to be a victim, because I want agency in order for me to be able to make the correct decisions for my birth like that not to happen again. Well, at least the very quick postpartum events that all unfolded. Yeah, I don't want to be a victim, because that denies me the agency to be able to change my circumstances in the future. But there was an intentional situation where my baby and I were being separated in a way that did not facilitate the best use of a placenta passing. Like, oh yeah, add to the very fact that it's like, oh yeah, we'll deny you a birth pool because you're high risk and you've got high blood pressure, so something could happen. except for the fact that it is proven to bring down blood pressure. Like, there were some things that, like, hospital policy meant, and this was the whole reason I didn't want to go in there in the first place, because I was like, some of the hospital policies are not in line with research or common sense. And praise God for the people who were there that were able to help and assist, and I'm so thankful for them. But sometimes it's like, how much did you make the situation worse? And that was a large part of my question. How much did I make the situation worse? How much did they make the situation worse? What am I responsible for? Okay, the answer is pretty much everything, in theory. And how is next time going to be different? So I walked out of there and I was like, I think I need a private midwife for my next birth, which was great. But then I kept thinking about it, and I'm like, and I chatted with many birth professionals, many specialists about, like, different circumstances, because I'm still seeing a specialist OB, because my preeclampsia was an ongoing thing. Like, it kind of got worse after the birth, and then, praise God, settled down at about 8 months postpartum after I really got serious about my health. But I was like to her, like, if I presented with all those symptoms, but not in labor, what would happen? And she was like, well, for your next birth, like, you would probably just get a C-section around 37, 38 weeks. And I'm like, A, they just throw out C-sections for whatever reason. B, oh yeah, add this. They're like, oh, because you had such a bad tear, you can just ask for a C-section next time and they'll give it to you for an elective C-section. I was like, oh, well, A, I don't want a C-section, so please do not suggest that to me ever again. But B, like, my baby wasn't ready to come. My baby wasn't ready at 37, 38, 39, even 39 and a half weeks to come. He came at the exact time that he was meant to. And even though that put my life at risk, I'm thankful. I am so thankful to God that I did not see doctors in the last half of my pregnancy, because I potentially would have gotten a C-section as early as 33 weeks. Remember, I was swelling that early. Like, imagine if my blood pressure presented the same way as my other symptoms did. I'm so thankful to God that I didn't see doctors for the last half of my pregnancy. Not because I hate them, not because I'm disgusted with the profession. One day I would actually like to enter the same profession. But because that would have meant my baby would have been forced to deliver earlier than he would have. And I know for the next year to 2 years, because they recommend a gap for a VBAC, I would have agonized over if I could have actually trusted my body to do the thing that I know it can do. My birth is hella traumatic, sure. But I'm so thankful for the autonomy that is reserved in it. I'm so thankful for the fact that really the only intervention that I had for the actual birth itself was them breaking my waters. I didn't have the gas. I didn't have an epidural. That is my award. You know how they say, you don't get an award for birthing naturally. No, I do. I don't have to go through questioning myself for the next several years, asking if my body can actually do it, because I know my body can now birth a baby, and I'm so confident in that. It's just the question of, can I get rid of the placenta? So yes, that is my award, that is my reward, that I can trust my body to be able to do the thing that it is designed to do. Aside from the whole preeclampsia. What the heck? What an example of the fall. Oh yes, my placenta is going to try and kill itself. How can you deny the fact that, like, sin has absolutely invaded our world? So yes, my birth was dangerous. Yes, it was controversial, but no, I do not regret it. Are there things that I would change? Yes, I wouldn't move 3 days before I'm about to go into labor. I am so keen to do a spinning babies class next time, because I think that would have really helped with Bub's positioning and a shortened labor. But for the birth itself, yeah, I don't regret it. Next time I'm going to fight for my kid. Next time I'm going to be a little bit more stubborn. And if that means I'm a difficult patient, then so be it. Because it's my kid's life. and it's my life as well. You could die doing this. Yeah, well, I could also die in postpartum depression because of some of the actions that I did or didn't do. That's as real as a threat for me as dying in labour. Dying because I was so crushed, so traumatised by what happened that I'd rather take my own life than go on. So that's something that a lot of people don't consider as well, the actual maternal outcomes afterward. I still, ironically, deeply, deeply desire free birth. I know one day that it will be a part of my story and I'm going to fight for it. I'm so excited to have that birth just completely alone, with my husband and I rejoicing in the beauties of it, with no one to try and intervene with taking my baby away from me, or trying to push my husband's hands away, or scrubbing vernix off of him, or suctioning my kid off on a CPAP. Okay, it's risky being by ourselves, but so is having incredible medical professionals around you. There is risk either way, and it's up to us to judge which one is the best. And so I deeply desire free birth. I don't know when it will happen, but I know one day it will happen. And I deeply desire 10 more kids despite the absolute trauma of the first birth. I don't know where the gospel is in birth. That's been a contemplation that I've been having for a long time. I don't know what Christ has to redeem of my story, of the things that we went through, and of the trauma that I had to wrestle with after. I would like to come to that answer one day, and I would love to share it with you all when I do figure it out. So if anyone has any gospel-led resources on the topic, I'd love to hear them. And I dearly look forward to the next birth. It's been a wrestle what we do. As you know, if you saw my video yesterday, it's already been a hectic journey with our next. Way more intervention than I ever would have desired. But it's about doing the best decisions in the moment with the information that we have provided. I can't expect myself to be a clairvoyant. I can't expect myself to be a prophet. But what I can do is make the best decisions for my family while I still can. And yeah, I look forward to the next. So what did you think? What was your birth like? I would love to hear it down below. In the meantime, stay holy. Love you guys heaps. Grace and peace from our Lord and Saviour. See ya.